Hi, and good afternoon. My name is Jeremy Davis, Senior Director of Embedded Solutions with Cerner Corporation. Welcome to our automated situational reporting demo. Our agenda today is to look through a hypothetical scenario that plays itself out every day in hospitals all over the country around patients that come in through an ER and inpatient setting, make a stay, and then are eventually discharged. And Cerner today is providing FHIR bulk data and FHIR API data through the SANER standard. And you'll get to see hospital data collection of that through the NHSN Link and the extraction of that data out, some hospital reporting through the SANER Server, as well as a couple public health examples of the utilization of this data. The Washington State Department of Health will demonstrate their capabilities, as well as a demonstration of the analytics from the NHSN SANER Server. Today with us is the CDC, NHSN with Lantana and Leidos technically supporting them, myself from Cerner Corporation, the THSA with Audacious Inquiry providing their technical support, and the Washington State Department of Health. Just to provide some reference to the public health infrastructure that this really represents today, from Cerner's perspective, we're supporting the EHR and other data source intake of this that is shared with the National Integrated Surveillance Platforms, this area in the lower right-hand corner. And we'll be providing some further demos of this today, of how this data intersects with the other public health infrastructure that exists in our country today, and a demonstration of some of the capabilities we look forward to deploying more broadly. Wanted to provide you with a little bit of the infrastructure around Cerner's input into this, our Millennium EMR platform and the clinical documentation that then provides FHIR APIs to the SANER standard to the Texas Health Services Authority and the CDC, as well as our aggregation of this data through our population health solution called Healthy Intent that takes Cerner data as well as data from other EMR platforms, labs, other types of data sources that we may ingest, and has the ability to provide bulk data to the CDC via the NHSN, as well as to do queries back to more targeted specific queries from our Millennium database as well. And with that, I'll turn it over to Rick to begin our demonstration today.
All right, thank you, Jeremy. So I am Rick Geimer from Lantana Consulting Group and the Chief Innovation Officer there. And today I'm going to be showing NHSN Link, which is an application for the National Healthcare Safety Network that allows them to gather data on a variety of use cases. In this case, today we'll be demonstrating a COVID-19 medication administration measure. What COVID-19 medication administration data gathering, the goal for this is to get live patient-level medication data for inpatient encounters for patients that are positive with COVID-19. We're going to do this using open standards and an open source reference implementation. The results here are near real-time data on medication usage with minimal burden on the provider. The goal here is lights out automation wherever possible, so we want to gather all the data in an automated fashion, minimizing the required to do any manual data entry. This process can also evolve rapidly and adapt to a rapidly changing environment. It allows the CDC to change the criteria for which they define the COVID inpatient cohort, and also add or remove supplemental data that they want reported. We do this via FHIR bulk data for getting an initial patient list of active inpatient encounters for a given day, and then we combine that with FHIR queries where we go back to the EHR and pull out additional data like comorbidities, the actual medication administrations, and the lab results that we'd use to determine if a patient falls in the cohort or not. We then evaluate that data, or those data, against a SANER compliant measure that is maintained on the CDC server. And then when the measure has been evaluated, we send the calculated results back to that same server for further analysis. So here's how it works in a nutshell. An infection preventionist will log into NHSN Link via the user interface. That will then also authenticate them against the provider environment using OAuth 2. Once the user is authenticated, we then pull the latest measure definition from the NHSN server, so we make sure we have the latest criteria and data for reporting. At the same time, we'll begin pulling data from the EHR, again using that bulk data feed to identify the patients of interest, and then querying for those additional resources. Lastly, we'll evaluate the measure, and then we'll package that up and submit it as a measure report to the NHSN server, same one that we got the measure definition from, and it's available for further analysis. We also have the ability, if we want to pull data from other systems via CSV. Keith will talk more about that later, but we're not actually demonstrating this for this use case because everything we needed was available via FHIR. So where is this used? Well, this medication administration data is used for public health surveillance, expanding on CDC's experience with outpatient medication data, and also for hospital quality reporting and benchmarking, expanding on CDC's experience with inpatient antibiotic use. And it could allow us to do things such as query back to the beginning of the pandemic, since we can do reporting on any day that we want. We can see what, back at that time there were therapies like hydroxychloroquine that were in use, and we can look at the use that was going on then, go further in time and examine the outcomes from those medications, and then fast forward all the way today and look if there are still sites that are prescribing these, and if so, maybe recommend different therapies based on our experience throughout the pandemic. So at that point, let me go ahead and switch over to the demonstration. So this is NHSN Link, very minimal user interface here because again the goal is lights out automation wherever possible. I've already logged in with my credentials and authenticated with OAuth 2. So next thing I'm going to do as an infection preventionist is select a date that I want to report on. I happen to know the Cerner EHR has data for July 13th, so I'm picking that. And then I can select a variety of use cases or measures here. I'm going to select the NHSN Medication Administration measure, and then I'll click Generate Report. Now normally this would go out and start querying the EHR, pulling out data, doing measure evaluation. That can take several minutes. So right now the application is smart enough to know that I've already generated a report for that day, and it's cached it, and it's asking if I want to rerun it or see what I've already saved. So I'm going to take a look at what we've already saved, and here we can review the output of this measure. And again, it's very simple here. It just shows that we had a count of 30 inpatient encounters that match the COVID-19 criteria that we're looking for. And behind the scenes, we have this measure report. This is a FHIR measure report resource in JSON format. It's mainly here for debugging purposes, also useful for things like HIMSS here, where we can show that we're actually doing real FHIR and presenting real stuff here. So at this point, I can send this off to the NHSN server that Lados will be demonstrating later. I can also download this if I want to view the raw data. I've already done so I can go in here and take a look and see that there's line level data like patient demographics here, so I can capture date of birth, gender, etc., and stratify by those later. I can show the lab observations that put the patient in the cohort for this measure. In this case, a positive PCR test for SARS-CoV-2. And here's some of the comorbidity information that Lados will be using later. In this case, a FHIR condition resource showing hypertension. And lastly, the key data for this use case, which is the medication information. In this case, I brought up a medication request, which is an order for the Moderna COVID-19 vaccine. All right, with that, I will hand over to Dave Pike.
Hi, I'm Dave Pike. I'm an interoperability subject matter expert for Audacious Inquiry. Just to recover where we've been, we started off at the EHR. That was Cerner, who provided the data into the use case. That was passed off to the SANER application, the NHSN Link application, which took that information and turned it into a measure report for a single location. Now we're going to talk a little bit more about what the SANER Server does. Before we do that, I would like to talk about the features of the SANER FHIR implementation guide itself, which was designed to create automated reporting using FHIR, the latest of the healthcare IT interoperability standards. This takes that information and integrates it with not only FHIR information, but legacy data from non-FHIR-based systems, because not every system, not every server can support FHIR yet. So we talk to them using flat file CSV. This allows us to do data aggregation across systems, across hospitals, across counties, and create an aggregate report showing where everything is at that time, often in near real time. The real benefit you get is it applies process controls to the measurement of this data. That means that Previously, we got by fax or email a form that had to be filled out several times a day that was interpreted by the person on the receiving end. By using automation, by using process controls, we create a standardized report using measures that have been interpreted one way that can be counted on and used consistently right through the system. Now, right now, we are piloting this through the Texas Health Services Authority. They have received funding from the Office of the National Quarter for Healthcare Information Technology under the STAR HIE cooperative agreements. And they're pilot testing with hospitals in the Texas area. Audacious Inquiry, my company, is supporting it. We are the technical vendor in this. And of course, all of this being coordinated through the Centers for Disease Control and Prevention, as well as the U.S. Digital Services, and local agencies on the ground in Texas, including DSHS, and vendors like the ones you see here. Now I'm going to hand this off to Keith Boone, who architected the SANER FHIR IG.
Thank you, Dave. So I'm Keith Boone. I'm a standards guru for Audacious Inquiry. And we've been talking about what's been happening with SANER inside the hospital. We'll talk a little bit now about what happens with SANER and a SANER server in the public health environment. And to do that, I'm going to go ahead and start up my SANER server. And as Rick has said earlier, sort of a lights out demo. There is no flash. There is no glitzy user interface. This is all server to server communication. So what's happening is when the server starts up, automated job is going to go collect a measure from that is published by public health. Server can then have that measure be interpreted, go collect data within a hospital via FHIR. And so we see here where the measure is collecting data from the hospital and eventually producing a measure report, which will then be stored in the SANER server and made available to the public health agency. And as it's going through and collecting, it's going to collect measures, it's going to collect observations, it's going to do some confirmation of whether the patients have COVID and there's been a positive lab test, or if they're simply a suspected COVID patient. And then we have the produced measure report, which is going to show the number of available beds in the hospital, the number of beds that are in use. For those beds in use, that measure report is going to be able to make available information about who is actually using a bed by age, by gender, or other social determinants of health, to help public health understand the impacts of a disease like COVID on various populations, and also be able to balance load. So next, I'm going to turn this over to my colleague, Ravi, working out of the Washington Department of Health, and he's going to show how a state like Washington can use all of the data that is available through the SANER server in their analytics and reporting.
Thank you, Keith. My name is Ravi Kaufman. I'm working as senior epidemiologist and informatician with the Washington State Department of Health. So today I'm going to show how the platform that Washington State has developed is going to receive the data from SANER server, and it's going to display the data onto the platform. And the analytics that would be utilized. So WA Health is the platform that has been developed by the Washington State, and it is developed in response to the COVID-19 pandemic, collects data for bed capacity, COVID-19 activity and spread, staffing issues, and supplies, equipment use and constraints. And it collects key hospital and healthcare data and provides the data in a seamless way to support the leaders across the state to make timely and informed decisions in response to public health threats and emergencies. So the data could be inputted into the system either through manual data entry process or bulk data upload service. And there are over 80 matrices reported per hospital on a daily basis. And this data basically supports 4 different functions. Situational awareness is the main function that it supports, and it helps in emergency response planning and activation to public health threats. It supports disease surveillance activities, supports resource allocation across the state, and also supports the patient movement within different facilities within the state, and also in different health service areas. The state is working to automate this system, and we are looking to automate the system to reduce the reporting burden, improve timeliness and precision of the data. So this work is going on in 2 stages, and in the first stage the data will be received by the SANER server as an intermediary, and the data will be passed over to the FHIR server in Washington DOH, and that data would be uploaded into the WA Health dashboard, and then also would be passed over to the federal agencies for reporting. And in the second phase of the project, we will be receiving the FHIR bundles as well as raw data, and then calculating the matrices in our server, and then uploading the data into the WA Health platform, and also passing it over to the federal agencies. So I'm going to provide a few glimpses of the dashboard that has been developed. So this is the platform that has been developed that I was explaining about, and it has information about the COVID-19 patients. It has information about the staffing situation, availability of beds, and occupancy rates of the beds, equipments and supplies situation throughout the state. So this is a glimpse this is a summary for the whole state, and it has the breakdown by the counties as well. But there are drop-down menus up here which has the disaggregation by health systems, health facilities, and also parent organizations as well. And if one would like to go into more details related with the patients, there are different tabs down here. This tab particularly has details about the patient, and also the mappings regarding the patient burden. And there are other tabs which deals with the bed capacity details, staffing details, and also equipments and supplies. And also there are other baseline data that is available in other tabs in the dashboard. So with that, I will pass the mic over to Austin from NHSN Lidos for his demo. Thank you.
Austin?
Thank you, Ravi. I'm Austin Chrysler. I'm a technical fellow with Lidos, and I'm here representing the National Healthcare Safety Network. I'm going to give you a little background about NHSN first. It's a CDC surveillance system with multiple users and uses. It was launched back in 2005 and currently has over 37,000 healthcare facilities enrolled in it, with more than 110,000 individual users actively using the system regularly. NHSN is used for surveillance of healthcare-associated infections, antimicrobial use and resistance, vaccination coverage, blood transfusion safety. We added COVID-19 surveillance last year. That's primarily focused on long-term care facility reporting. Any facility that reports to NHSN is able to access their local data that they've submitted directly through a web-based interface in NHSN, but we also make that same data available to state and local health departments for the facilities in their jurisdictions. NHSN also provides clinical quality measure data based upon that submitted data to CMS for their use for payment programs and such. So the data that is submitted to NHSN from facilities, it comes from a variety of sources within those systems, including laboratory information systems, EHRs,
ADT systems, and other systems. That data is extracted locally and bundled up in a CDA document today, and that document is submitted to NHSN. In the future, we are hoping to supplement that data using FHIR data standards, and in particular using the SANER measure report infrastructure that we're showing today. NHSN receives that data. Our analysts, data analysts, take a close look at it. Among other uses, they do extract quality measure data that is sent on to sent on to CMS. This diagram shows how NHSN is planning to use the FHIR SANER implementation guide. We have a demonstration FHIR server set up for NHSN now. It is able to provide NHSN SANER-based measure definitions that can be utilized by applications such as NHSN Link and the Audacious Inquiry application. So you've already seen today those applications query hospital systems for data to create standard measure reports based on SANER and include supplemental data that's all submitted as a bundle, FHIR bundle to the NHSN FHIR server, which then can extract that data as data sets and dashboards and other types of data provisioning, which we provide to local, state, and federal partners, and providing controlled access to that data. I'm now going to show you a demonstration of one use of that supplemental data that is being submitted to NHSN. We have a map of the U.S. here. Here in the Chicago area, you can see a big red dot with a number in it. That 8 indicates a comorbidity rate for the overall area. As we zoom into the map, we actually drill down into NHSN-related facilities in this area that are reporting to NHSN via measure reports. These are obviously examples, and this map is showing comorbidity rates within particular facilities in that area based upon the example measure reports that have been submitted. So at this particular facility, we have a comorbidity rate of 7.97. So zoom in and out, it will aggregate at higher and higher levels, or you can drill down and see it in more detail. But this is one example of the supplemental data that is submitted alongside of a measure report that possibly use the HSN. Okay, so in wrap up, automated situational awareness reporting based on SANER enables stratification of any computable attribute that's included in the measure report and supplemental data. That includes things like age, gender, race, ethnicity. We saw an example using location data, which is in the measure report for geography, and showing comorbidities based upon the locations that are submitting data. NHSN can use this for health risk factors, outcomes. The line level data enables reporting for risk adjustments, research, and analysis. NHSN is extremely interested in getting that line level supplemental data to perform risk adjustments, look at risk factors associated with particular measures, and determine what those risk factors have on outcomes. Some of the applications you've seen today are open source implementations. In particular, the NHSN Link is intended to be a reference implementation that others can pick up and utilize for submitting to NHSN. And so I think this wraps up our demonstration for this vignette.
So if there are no questions, we'll look forward to seeing you at the next HIMSS demonstration, where we'll come back and tell you how we did.